This episode of the Second Floor Podcast is brought to you by Edmonton Community Foundation. The foundation acts as a bridge between donors and charities to create a strong, vibrant community for generations to come. You can start an endowment fund yourself or with a group. Once it reaches $10,000, it can start distributing. Vital Signs is an annual checkup conducted by the Edmonton Community Foundation in partnership with Edmonton Social Planning Council to measure how the community is doing. This year's focus is on millennials. Learn more at ecfoundation.org.
Hi, my name is Amir Mohajery. I am a respiratory therapist, and a little bit about me. I'm a big fan of soccer, as you can tell. I like playing sports, golf, whole host of physical activities, as you will. But yeah.
My name is Marco Manarino. I'm a family physician here in Edmonton. I work at an academic teaching site at the Northeast Community Health Center. So that means I have medical students and medical residents working with me essentially all of the time. I also am involved in primary care networks here in Edmonton, which provide kind of extra services that you wouldn't normally get in a family doctor's office, things like dietitian, mental health counseling, kinesiology, etc.
Hi, my name is Natasha Osmund, and I am the owner of Holistically Fit. I am a holistic health practitioner, specializing in nutrition, personal training, lymph, and especially gut health.
My name is Csorba. I'm actually a shit disturber trapped inside of an artist's body. So I'm an artist, a community builder, and now I'm rebuilding the healthcare system from the bottom up.
Tania McDonald. I work professionally as an agriculture research tech. I'm a mom and I'm a baker.
Hi guys, my name is Mohajery. I'm a physician here in Edmonton, Alberta. I work in pediatric immunology and infectious disease. And thanks for having me. I'm here to talk about and help navigate whoever's listening through the pandemic today. And part of my job as a physician is to be an advocate for people so that they have make good, sound medical decisions based on what's going on. And so I'm here to help interpret some of that.
My name's Noah. I'm now working as a registered nurse. I've been working as a registered nurse for the past year and some, and graduating right in the midst of a global pandemic was it wasn't exactly a difficult thing for myself, because it came into the stance of like, you chose this role. This is part of the role. You can't just be like, oh wait, something negative's happening, I have to step away. And now being able to have a conversation around COVID and the intricacies of it and the intertwinings of things that aren't talked about on a global stage is the reason for being a part of such conversation and wanting to add my point of view and share kind of some things that I've taken in for myself on a personal place, as well as some experiences in working with a variety of different people who are either diagnosed with COVID, living with people who have COVID, or just in different health standpoints of conditions and variances of health.
My name is Sajjad Fazil. I'm a postdoctoral associate at the University of Calgary, and I'm currently conducting research on COVID-19 misinformation and vaccine hesitancy.
How does your your job, your occupation, how has it tied into the pandemic? Have you seen changes? Have you seen the people that you work with, clients, patients, that type of thing? Do you find things have changed drastically in your work life?
For myself, at the beginning of the pandemic, I was working as a respiratory therapist with a sleep clinic. So I was working with patients dealing with sleep issues, CPAP, BiPAP. You might have heard about these things. I was doing home care. So in terms of my patients and my clientele, it was very specific. And as soon as the pandemic hit, I actually remember I was with my parents actually out in Ontario, and when we were all together, and I was realizing, and they called us and said, hey, I don't think we're going to go back to the office for at least a week, and blah blah blah, and this and that. And at the time, we knew it was going on, but you could just tell I was thinking, wow, if I come back, am I still going to have a job? Are they still going to want me on? We will definitely be able, we're going to go through all these different motions in the company. Who knows if they're going to keep everyone on, looking at the amount of people that they had already, and maybe I'd be let go, but thank God that didn't happen, and all that good stuff. But yeah, in the beginning, it was a little bit scary kind of dealing with that. In terms of patients, I think the patients that I see, they have sleep issues, which are derived by upper airway diseases where the airway closes, they stop breathing at night. Sleep apnea is the main thing there. But I think, it didn't really affect my patients and the different patients that I saw, but what I really started to see was people asking me really deep, intimate questions about very simple things like breathing, carbon dioxide. Is this going to help me with if I get COVID? It was really interesting to see that, to see the kind of different the conversations kind of change as the pandemic kind of went on. I actually stopped working with as a sleep therapist about a month ago, and I've been with the CDC and AHS working as a contact tracer for the pandemic we're in. So yeah, my current position is as a contact tracer investigator. So what I do on a day-to-day basis, on a full-time basis, is we get the case, someone's positive for the COVID virus. I make my call, I conduct an investigation, gather any contacts they've had in the last 14 days. It's quite interesting, actually. It's shown me a lot about, there was a lot of stuff that I didn't know about the virus. And this is it's been a bit of an eye-opener for sure. Because it not only does it talk about, what the virus does and the incubation period and all the science behind it, but also it's shown me the kind of conversations that I'm having with people that, might not really believe in it, might not really want to even answer the call, might not want to tell me the intimate questions that I might be asking, which is fair. But it really, it's a mix of sociology, I would say, and medicine is where they kind of meet in the middle. So it's been really interesting, like the kind of conversations that I've had with people that are very, very diligent with their their quarantining and their isolation and keeping their cohort small. And then there's also the people that tell me, oh yeah, last week I was over here, I was at this place, the next day I was here, I've been hanging out. Okay, well, I can't penalize you, but I'm glad you told me, so at least now we can go into it and find out where you got it from. So it's been very interesting.
A lot of the risk mitigation, that's sort of the realm of public health. So things like, lockdowns and vaccine rollout, things around schools and school closures and things like that. So those are the big things. At sort of my level, what I deal with mostly is trying to educate my patients about, number one, what's going on, and number two, what they should be doing, which is sort of the best evidence-based things they should be doing to safeguard their own health. In addition, with COVID, there's also kind of this, you might hear like the shadow pandemic, or kind of all these different terms to describe essentially people being too afraid to seek medical care. So they don't want to go to a hospital or don't want to go to a clinic, but they actually have like significant health issues going on. And so we've noticed that, this was more sort of earlier in the pandemic, that people were very afraid to go to their doctor. And as such, they just let health issues brew until they got to the point where they were very sick. And also there's the undiagnosed cancers, a screening that's not being done, etc. So a lot of my job is to kind of make myself available through non-traditional means like phone appointments, virtual care appointments, just so that if somebody is sick or has a health question, they're not just sitting at home too scared to go get it dealt with, and then leading to more problems for them down the road.
So holistically, what we can do to help you stay healthy, whether it's not getting COVID or not getting any other illness, we have to get back to basics. How's your mindset? How's your sleep? Are you hydrated? And I'm not talking about are you drinking the water, but are your cells absorbing the water and putting it where it needs to go? How's your bowel movements? How are you peeing every day? Are you having fun? So it's not just calories in, calories out, not just macros or movement and burning calories. Sometimes it's the things that we can't really measure and it's subjective. And health isn't always measured in lab works or in weight. It's measured it's more dynamic. So it's measured in function.
So what I do as a physician is I have a very specific type of patient population. I take care of adults and children who have compromised immune systems. And so when you have a compromised immune system, you are at higher risk of all types of infections. And for some people with compromised immune systems, they are at higher risk of bad outcomes with COVID. So part of my personal patient population is that I want to provide the best possible information about the pandemic for number one, that patient population. But even in the broader sense of that, I have a solid medical background in immunology and infectious disease, and so I feel like I have a good voice to help interpret some of the confusing literature and medical literature that's out there for the general public. I mean, I do that even for my friends and my family as well too, right?
When it comes down to being in the role that I am and working in an emergency room at the Northeast Emergency, it's the place of knowing that people are coming in day to day of screening positive for COVID-like symptoms, and knowing that there's people out there who are going to fall in that category, whether it plays into being a positive case or not, or just simply something tied to an entirely different reason for presentation. And it's the realization that there's no way to, I guess, not be a part of such an environment, and seeing the way that things are navigated, where everything's a protection standpoint. There's the endless PPE, there's goggles, there's masks, there's gloves, there's cloaks, basically, gowns that we're wearing in and out for each patient, each contact droplet sign that's on a door. And knowing that for myself, it's a protectionary standpoint in my own health, but also not even just myself, but it's tying into the standpoint of maybe if so-and-so is a COVID positive, my next patient's a 87-year-old individual with an extensive comorbidity list, that if I'm not being protective of my own self and the ways that I'm interacting with this person who's positive, now how am I going to interact with another person who's at a higher risk for the reasonings? And if I'm not being cognizant of that and taking the ownership of that, then how am I going to provide the best possible care?
So I guess that what we have to recognize, what's kind of difficult about this virus, is that even people that don't have compromised immune systems can be at risk for really bad outcomes from it. As we're a year plus into this pandemic, we not only know about the acute effects of COVID, but there's increasing data that there are long-term effects. That you can have long-term symptoms and lots of not just mortality or people dying, but what we say morbidity, so decreased health overall for people that have acquired infection. Now, there's a huge range of that, right? There's people that get the infection or are asymptomatic, or people that feel it as a cold, but there are people that have significant symptoms, and then on the very extreme end of that spectrum, have mortality or die from the infection. And so when you talk about the immunocompromised population, I mean, there is, like you mentioned, that fear is huge. So any fear, if you remember back when the pandemic first started, everyone is a little, we didn't know a lot at that time, and so there was a lot of unknowns. So that was just compounded by like 20, 50 for people with compromised immune systems who've lived in fear of many types of infections, not let alone like novel infections that are affecting the world. So
this episode of the Second Floor podcast is brought to you by Shift by Alberta Innovates. Our province is a hotbed of innovation. Now, in season 2, Shift's hosts Katie Dean and John Hagen put the spotlight on Albertan innovators working to improve the world, one ripple at a time. Here's a taste of the Shift podcast by Alberta Innovates.
Make Shift by Alberta Innovates your next podcast binge. Join us as we take a deep dive with the people that are driving Alberta's 21st century economy.
These global movers and shakers are working to solve today's challenges, create new opportunities, and build a healthy, sustainable, and prosperous future for Albertans today and for generations to come.
Just when you think you know all about Alberta, we're here to shift your perspective.
I don't know if I could stress this enough. We have a top 3 institution in arguably the most important technology in the entire world right now.
We will prove a lot of people wrong by coming out of this even stronger. And the way we will do it is by finding ways to help businesses be cash flow positive and by willing to, find the ways that we can help.
We're just starting to scratch the surface. I mean, Calgary just this last month announced the fact that they broke their record again for venture capital investment. And some of this is in fintech, some of this is in a whole bunch of different areas where we originally didn't even have these types of core industries in Alberta.
We have diversification in our DNA. We just have forgotten about it.
Sincerely, we are blessed in Alberta to have all the infrastructure that we do have.
Tune in to Shift by visiting shift.albertainnovates.ca or your favorite podcast app.
A lot of people are, talking about the risks of getting the vaccine, and risks associated to the vaccine. In your opinion, what's your opinion on the vaccine as a health professional? And where, what do you say to the people that, are, see it as a, as a risk, and what are your thoughts overall on the vaccine?
I say, my thoughts on the vaccine, or any vaccine is trust your healthcare professionals. Trust your healthcare. Trust the government that you are paying taxes to, that are there to protect you. I'm glad we're talking about the vaccine because I've got both of my doses. I have family members back home in Iran who are forced to paying, hundreds and hundreds of dollars that they probably don't have for a vaccine that might not even be the real deal. And we're in Canada talking about the AstraZeneca vaccine that might have 6-7 people out of millions that have shown blood clots. I mean, there are higher risk of birth control for women to cause blood clots. We're not regulating that. Where's the outrage for that? There is this growing dogma that that all of this is some kind of conspiracy against us, that the government's trying to control you. Microchips, this, that. Come on, let's get with it. And we're surprised that we're still a year and a half into a pandemic that we're trying to get rid of. Maybe it's because we have thousands of people protesting at the legislature every week because they're upset about putting a mask on their face. And then we have people across the world, not paying food for their kids, not, bringing food at home, not, spending money on clothes because they're more scared about getting the vaccine. So they'll pay anything to get something in them that might have any effect. It's to really think about this stuff. You really have to look at the worldview and see how people are really handling this. I know for a fact that there's people in Iran getting the wrong stuff.
The AstraZeneca vaccine is the one that's been mostly associated with more severe outcomes, whereas the Pfizer and Moderna seem to be, you do get some side effects like after administration. About 20% of people get a pretty severe flu-like illness for a couple of days. So, you're tired, feel run down, you might have a bit of fever, you might have muscle aches, that kind of thing. Typically, it's worse after the second shot. I had the Pfizer vaccine. My personal experience is the first one was not too bad. Had a bit of a sore arm, went away in a day. Second one, I had about 1 day of feeling tired, feeling a little bit run down, just took a Tylenol, rested a bit, it went away in 24 hours. That's my personal experience. Some people will have more of a severe reaction. But the sort of life-threatening reaction is associated with AstraZeneca and Johnson & Johnson vaccines. That's basically blood clotting. That being said, we know we've had some cases in Alberta, and it's obviously when somebody passes away, it's a terrible tragedy. There's no two ways around that. But the odds are very low. It's something like 1 in 700,000 people that get the vaccine will have that blood clot reaction. And most of the time it's treatable. So that being said, the benefits of the vaccine far outweigh the risks.
Well, I think we again need to take a step back and not apply such loaded terminology as myths or conspiracy theories or black and white truth. Like, we're learning things as we go as a medical community, as a scientific community, removing that emotionally charged component to the terminology we use surrounding this collective experience, the science. It's not necessarily a myth or conspiracy. They're just asking questions, the way I see it. And true science can stand up and hold its weight against questions and being scrutinized. And that's how we make progress with science, is asking questions, asking hard questions, putting it to the test time and time again, and seeing which method wins out. And the reality that we're seeing is that the vaccine, yes, it was produced in record time, and there's going to be some issues with it, but there's also going to be issues for the people if they get COVID. So again, we have to choose our hard. It's an individual decision. We have to choose which one is the best for us.
When we talk about getting the vaccine, I think the most important discussion we need to have is the risk. We have to look at the risk. Is it risky to get the vaccine, or is it more risky to get COVID-19? You're more likely to get blood clots and die of COVID-19 than you are with a vaccine. It is very, very rare occurrence of having a blood clotting with the AstraZeneca vaccine. So if you compare the two, this is how you look at what you need to choose. And I'm not saying that one person has to decide this or that. We all should be taking the vaccine, but how we come to that conclusion is by weighing the risk. And only if we understand how the vaccine works and how the COVID-19 virus works, can we say, all right, this is more risky. The vaccine is safer. Of course, I'll be taking the vaccine. It's a no-brainer, but you need to have that information to make that choice.
Well, with respect to vaccines, I'm not an expert. I've read a lot of the literature. I think the information is going to be very dynamic and agile moving forward. So, for example, in Russia, they have a 1 and a 2 dose system, and the second dose is in fact different than the first dose. I think from a global perspective, because of the sharing of information and the accelerated cycle in which the vaccines were developed within the proper guidelines, I think we're really lucky that we do have 5 or 6 different choices, and they're all very, highly efficacious. So I support the vaccination programs they have out there. I know that there is one vaccine that has side effects that can lead to death. But from my own personal experience, the only, the data that I don't have that makes me feel just a little bit uncomfortable is a clinical study I did when I had cancer, where I was given these pills to retain my saliva glands because of the heavy radiation that I received. And yet the pills didn't work, even though 2 rounds of clinical studies said that there was a 90% or an 89% efficacy that they would work. And when I dug deeper into those studies, it appeared to me that maybe they didn't test the pilocartin Salogen pills on head and neck cancer patients that had undergone a few rounds of radiation and that were on morphine and hydromorphine, and the test subjects were different than me, and that's why it failed. In fact, it failed on everyone.
Because of my research background, mixed with slight paranoia, if I'm being honest. I mean, I didn't go to Costco till probably in the fall. I hadn't been. I'm not a super regular person, but I didn't go because I just couldn't stand the thought of all those people. But I can have my flash moment of, we'll say panic and use that term loosely, and then sit down and say, okay, where are the facts? And thank God my husband loves to research. And so, honestly, I'll just turn and be like, look this up, please. And so then we sit and discuss it. I'm type 2 diabetic. I have, I'm sure, scar tissue on my lungs from a car accident when I was 16 from being on life support. There is no way I would even hesitate for it. I stood in my kitchen and cried when I saw the announcement that my age group, what were we, 2B, I think, in my 40s, type 2 diabetic, could book it. I booked it, I cried. I cried when she shot me in the arm. It's just such a momentous occasion, which is so weird. And why would we deny ourselves protection against this, what's been called the slippery virus? We're watching the variants develop.
I'm really glad you asked me about that, because it's like one of my favorite things to talk about, because I feel really passionately about vaccines. It's a lot, it affects the patients I see. It's part of some of the research that I do. And I agree that, I can see where the confusion and the fear regarding vaccines is coming from. I understand, because the messaging is confusing. And it can be interpreted in a couple ways. But what I want to help, everyone listening to understand is that, the public health system and the health system values vaccine safety overall. That is a number one priority, is vaccine safety. And so what you're seeing is new vaccines coming out for a new virus that are being tested kind of in real time. And what you're seeing is physicians and public health officials getting that data, analyzing that data, and taking appropriate safety measures and pauses before making these recommendations. So it sounds like, first there's this vaccine, and then if we take the example of AstraZeneca, it's for good efficacy. It prevents mortality and prevents hospitalization from COVID. It's a very, very good vaccine. But then and so it was recommended to a certain age group, and then we started to see, because of the heavy safety monitoring of vaccines, these signals that, yes, there are these rare side effects that result in blood clots and lowering of your platelets in certain individuals. And so very appropriately, those cases were reported to the global community. They were reported to everyone. I think we know about almost every case in the world because of how vaccine safety is being monitored, and people were able to take the pauses and say, okay, we need to make sure that the medical decisions or public health recommendations that we're making with regards to these vaccines are not causing more harm and are actually beneficial. And so people have taken those appropriate pauses, and then now you're seeing the changes in that. So then now AstraZeneca is down to, initially down to 40, and now as of today, people over 30 have been okayed to get it in Canada. So it's I know that type of, it can be viewed as flip-flopping, or how we don't know anything about the vaccine, but that's not the case. It's that people are learning about it, and they're taking the appropriate pauses, and it's because they're taking those pauses because safety is of the utmost priority when it comes to vaccines. Vaccines are the most monitored, actively monitored, passively monitored medical intervention that we have in modern health today. There's no drug that we monitor as heavily as vaccines. There's no medication that you've ever taken that we monitor as heavily from adverse effects as we do vaccines.
I guess when it comes to seeking whether or not to choose to go and get a vaccine when it's available to you, and ever now where the lowest age I believe is 18. So anyone over 18 is able to go get a vaccine and, sign up? What's the word? Register to go and get one kind of thing. But it's not even, it's the capacity for it to not just change your life, but change those around you and their lives in a way where you're no longer having to worry about being that person who could be infected and is asymptomatic. You're walking around and you're feeling totally okay. Maybe you're feeling a little bit less energy. And you're like, that's okay. I just didn't sleep so well. But you actually are now illustrating a positive sign for the virus, but you don't actually know because you're relatively healthy as an individual. You don't have any pre-existing metabolic comorbidities attached to yourself. You're living a lifestyle that, you work out 2, 3, 4 times a week when you're able to. You go for a walk every second day. Maybe you bike to work. Maybe you're eating a nutritious diet or nutritious meals consecutively. You're kind of looking over those things. So, your body, your immune system is prepared for it. But now you're communicating and you chose not to get a vaccine, and now you're interacting and you're on the street or you're in the store and somehow you sneeze into your arm, you touch your hand, and suddenly you touch a granola box, and now the granola box is touched by an 83-year-old lady. Now what happens? And it's the unawareness on some level as to the benefit of it and the science behind it, where it's the signs and symptoms that you have after getting a vaccine are simply natural things that are occurring because now your body is properly having to fight the just broken down side of the actuality of the virus, where if the virus came into yourself normally at 100%, the vaccine itself is at a 0.001%, and your headache, your fatigue, maybe your fever for 12 hours, your muscle aches are normal. If you're not having those, then there's the bigger question of why not. Maybe your immune system is just so prepared. You have an exquisite amount of T cells within your body, which are more or less the policemen of the immune system, which immediately kind of sounds the alarm for the body to be like, hey, guess what? There's something that's not supposed to be in here that is in here. We should start doing something about that now.
If we actually look at some of the things that we do to ourselves, like smoking, being overweight, taking birth control pills, drinking alcohol, they all have a much higher risk of causing blood clots than the vaccine does. And also you have to look at it this way, that your risk of catching COVID and having a bad outcome from that is like orders of magnitude, so many times higher risk than the vaccine itself. That being said, 1 in 700,000 isn't zero. So unfortunately, some people are going to have a severe outcome. And, I think in Canada, the approach, and even in some countries in Europe that we've taken, is that we've decided that because of that risk, that maybe we're not going to move forward with AstraZeneca vaccinations and focus on the Pfizer and Moderna, which we kind of know to be safer. And millions and millions of people around the world have now had these shots, and we know we have lots of information that and lots of data that tells us that these vaccines are very, very, very safe.
I've received my first dose. I'm going to get my second dose in a few weeks. I'm slightly uncomfortable that this thing has moved so quickly, but I was willing to take that risk because of the focus that I mentioned earlier on the clinical response. It was the only way the powers to be could get control of this pandemic, was to throw a lot of resources into the clinical response. And I think, I feel pretty confident that, they got it 95%, maybe 98% right.
Our money is going to that. Your taxpayer money is going into people actively looking for side effects for these vaccines. We're not even just waiting on people to just passively tell us about the adverse effects they're feeling. We're actively looking for those adverse effects and reacting. And every year, not just the COVID vaccines, but all vaccines get monitored for these side effects. So safety is the number one priority. And so I understand the messaging can be confusing, but what I hope that, instead of feeling more discomforted that we don't know anything about these vaccines, why would I get it now, is that we should feel comfortable that these vaccines are being recommended with the utmost care, with the utmost looking at the medical evidence and the utmost care for the public health safety of Canadians and Albertans, right? So
I'm not in favor of mandated vaccines. I'm in favor of informed consent, and it's your body and you get to choose what you put in it, on it, have done to it. So yeah, I am in favor of informed consent.
When it comes to vaccines, the necessity of the vaccine is sure, there's definitely herd immunity. Sure, there's definitely the ability for your body to recognize the virus again, and it's been shown. But the showing comes down to an array of percentages where someone who is just kind of at a B plus A rating for their health overall is at like a 90% of getting reinfected and having asymptomatic sides. But if you're, again, someone who is 83 years old and you got COVID, now you're past COVID, and then again 3 months later you become reinfected, you're at like a 47% chance of not having to be rehospitalized for the virus. And that's the difficulty that we're facing, is where people are like, sure, there's herd immunity, why can't my body just react to it normally? But when it comes to the vaccine, as we've been told across, where Pfizer itself is at like a 96, 97% effective rate, and that comes down to the amount of antibodies and T cells that are within the body and circulating and now able to neutralize that almost immediately. And that's the part that we're missing and isn't really being illustrated across, because if you're getting the vaccine and you're having reactions and the reactions are lasting longer than you would assume that they're supposed to, that's actually a sign for you to be like, hey, why is my immune system not as strong as it could be? What can I be doing a little bit more to enhance that just a little bit more so that I can, we'll say, take away a little bit of that effect, but at a longer time, because this is kind of like a wake-up call for a lot of people, and a lot of people are not wanting to wake up, because in waking up, you're now responsible. And you're responsible for your own self and your own health. And now what happens? If you're having to be in charge of that, where do you go? To hand washing, to masks, or to something else? But that something else isn't being shown. And that's kind of the difficulty that we're facing now, where some people are wanting to look elsewhere, but then they don't know where to look. So then they look at the McDonald's sign and they end up at McDonald's again, because there's an emotional pull. And that's the difficulty that I'm seeing now, where it's easier to do that than to get outside, eat something a little bit healthier, make that self-aware choice of like, hey, that'd be awesome, but I can't because of this. But then the because of this isn't something that's being informed about. So we're kind of like at a catch-22 where no matter where we look, we're still almost being faced with the essence of, we should just get the vaccine. It's the easier thing to do for everyone.
When you ask me about the vaccine, I say, why is it that not every single person hasn't gotten it? I mean, and then people are talking about, oh yeah, no, I'll wait for the Pfizer when that comes in. What are you talking about? There's a vaccine ready for you. Go get it. You know, it's if we want to move on, if we want to achieve herd immunity, if we want to achieve, lower and lower infection rates, hospitalizations, that's the way to do it.
It's important now more than ever for all of us as Canadians, as brothers, as sisters, fathers, mothers, parents, grandparents, to come together and look at the importance of the vaccine, at the importance of together following the public health recommendations and beating this virus. It's possible to beat this virus. It's possible to live in a world without COVID-19. We're almost there. We just need to be together, to united and work together, following all the recommendations, motivating each other to get the vaccine, and we will definitely make it out.